horrifying.
I mean,
what's going on in there.
Everything with the health industry. I mean, it's insane. Like the fact that, they can do the kind of things that they're doing and overcharge people. Like the fact that we can't, with literally every other thing in society, you get a list whenever you purchase something, what you're paying for. You buy something for your car, you get a new car, they list out every little thing. But the health industry is just like, I don't give a shit. They're probably charging you like $20,000 for masks during surgeries.
This rant does feel good to hear.
Yeah. So
totally commiserate.
I mean, trust me, I'm all for like, a reform of the Medicare system and the big pharma and all kinds of stuff like that. I'm not for like, socialism, full blown socialism. I think that, there should be programs to, help people that are, in the lower class and stuff like that. But I think it really just comes down to.
I thought you were a universal healthcare fan.
It's
single payer.
It's that thing of
collective negotiation.
It's hard to get on that when like I feel like the way you address the big pharma issue is by regulating big pharma and like making them show you like what you're paying for, and also making it where they can't overcharge you.
Like, it's definitely that, but it's also so much more. It's it's about the level of public investment that we give them that they don't give us a return on.
But you understand that, like, for me, like as I've said with pretty much everything we've talked about, even today, it's like I'm one of those like, hey, like why don't we do something first and see how that change works, rather than like
an incrementalist.
Because essentially what you do is if you make universal healthcare, like all the stuff that you're talking about, you're still funding big pharma and their policies and the things that they continue to do. So,
but the idea behind a single payer is that you have more negotiating power at the bargaining table.
Yeah, and
like a union works.
I'm not
right?
saying there's anything wrong with that in the sense of like you're helping people, get into the
and you're
healthcare
increasing
system.
Competition among big pharma. You're forcing them to lower prices.
But that's my point. Is I feel like we need to attack big pharma with what they can do, how they can do it. Because again,
absolutely. But we also need political power and collective political power in order to demand things
it's
from
hard
them.
To do that
and they have a lot of power right now, right?
Yeah.
And so the way to deprive them of that power is to deprive them of the disparate insurance companies managing different administrative systems and billing practices.
And that's one of the first steps. But do you think that